Welcome to Thursdays at 3 p.m. Eastern Standard Time. My name is Jessie, the host of this podcast, which is all about beverage innovation. I talk with innovation pioneers from agriculture to glass. Thank you for listening, and be sure to subscribe to be notified of all new episodes.
So it's ductal carcinoma in situ. And so, yes, this could be considered a stage 0 breast cancer. And what that means is when they looked at your pathology, you had atypical malignant cells, but they were inside the ducts of the breast. So the ducts are kind of the passage in which when of course, you're producing milk, and that kind of helps to drain from the milk-producing cells, take them down out through the nipple. And so that's the area where a lot of cancers arise from, the cells that line those ducts. And so with DCIS, we see the cancer that is within those ducts, but it's not invading into the tissue. So I tell people it's kind of like having a tiger, but the tiger is carefully locked in a cage. Now, you give that tiger enough time, maybe months, it may even be years for some women, but you give that enough time, that can develop into an invasive cancer where it can get out into the breast tissue and cause more problems. So in patients with DCIS, we still will treat that like a true breast cancer, where we have to have that area completely removed and make sure that all margins are completely negative, meaning we don't see any evidence of any of those concerning cells at the edge of the sample that gets taken out. Enough.
Which is what happened with me. And, to Dr. DePasquale's point, it's when it's stage 0, you can't feel and you can't see it.
Enough.
So when they're going in and removing it, they can't tell if they've got the margins. And what she said is that they changed the margin needs. And where it is right now, she missed slightly, just a little on one side or something. So 3 weeks later, I went back in. And another surgery, just a quick one to come and scoop out whatever she needed to at the time.
Right. Of course, we try to do everything possible to avoid having to go back in and do any type of surgery. So things like breast MRIs that are done before surgery sometimes can kind of help the surgeon to kind of see the full extent of the area of concern. But this is kind of the nature of these, can be very sneaky. They can kind of trail through the breast tissue a little bit, where it can be really, as to your point, there's not really anything that you can see or feel in the breast tissue to really let them know, there's something here or not. And again, these could be, the only way to really see these is to look at it under the microscope and be able to say whether or not there's any cells, individual cells, that are at those margins. And again, we're trying to do everything in our power to make sure that this never comes back, that it's never going to be a problem for you in the future. So we want to make sure that every single cell that we can get out, gets out.
Produced by Fedora J Productions.